Lyme disease is the most common vector-borne disease in the United States. It is caused by a bacterium, Borrelia burgdorferi, and it is transmitted via the bite of infected black-legged ticks. Typical symptoms include fever, headache, fatigue, and a characteristic skin rash called erythema migrans. If left untreated, Lyme infections can spread to the joints, the heart, and throughout the nervous system. Lyme disease is diagnosed primarily based on symptoms, physical findings, and the possibility of exposure to infected ticks. There is some testing. However, the testing is imperfect and may fail to diagnose anything other than a very acute Lyme infection. It's important that we take some steps to prevent Lyme disease, such as wearing insect repellents, removing ticks promptly, wearing light-colored clothing, and helping to reduce the tick habitat. Now, you may think, no big deal. It's just an infection. We have antibiotics that treat Lyme. However, chronic Lyme disease is underdiagnosed, and the CDC estimates that approximately 10 to 20% of patients who are diagnosed with Lyme infection will suffer from long-term sequelae. Not everyone believes that chronic Lyme is a true phenomenon, but as we will discuss today with my guest, Dr. Jess Peatross, chronic Lyme can be very, very real and extraordinarily difficult to pin down what is going on and to actually effectively move this infection out of the body. Today, we are going to be talking about chronic Lyme infection and how we can identify the symptoms, recognize that there is an underlying Lyme infection that is a stealth infection, and how we can get rid of those extremely difficult to get rid of symptoms. This is my second interview with Dr. Jess. It's always great to have guests back on the show. You can go back and listen to my first interview with Jess back in episode 38, where we talk about what is broken with our medical system and how we can choose to intentionally live life in balance with our own bodies. Let's get to today's show, all about chronic Lyme. Welcome to the Lindsay Elmore Show, a podcast for people who deserve to be healthy, with honest, open, and enlightening conversations with doctors, thought leaders, creatives, and spiritual gurus. You'll walk away with simple and tangible tips and tricks that allow you to live your healthiest life so you can pursue your dreams, overcome obstacles, and leave your mark. Dr. Jess Peatross is a returning guest to the show. She is a visionary for the future of healthcare, an expert in the field of stealth infections and infectious disease, as well as biologics, regenerative medicine, cannabis, ozone, and environmental toxins. Dr. Jess is a board-certified internal medicine physician who trained at the University of Louisville. During this time, Dr. Jess experienced what many of her patients suffer from: anxiety, hormonal imbalances, adrenal dysfunction. She began to seek out real answers that got to the root cause of disease, not just for herself, but for her patients as well. After realizing that allopathic medicine was not perfect for helping to heal chronic disease, Dr. Jess trained in the realm of functional medicine, Gerson therapy, ozone therapies, and nutrigenomics. Her philosophy now embodies true health as being a combination of mind, body, and spirit. What she has learned and wants to share with the world is that our bodies are perfect just the way they are. 90% of our disease comes from lifestyle, diet, and environment, which ultimately changes our genes, and that every person has the chance to heal and reverse chronic disease. She believes that personalized, preventative, and functional treatment plans are the next step to revolutionize healthcare. Dr. Jess Peatross, welcome back to the Lindsay Elmore Show.
Thank you so much for having me.
It's always such a joy to talk to you because you are one of those clinicians that listens to people and looks for things that other people just say doesn't exist, it's not real, we're not going to look for it. And especially when it comes to a disease that differentially affects people depending on where they live. And so lots of docs in certain areas just get like, well, it's not endemic in this neighborhood. There's no way you could have this infection. And what we're going to be talking about all day today is Lyme disease and chronic Lyme infection. So talk to us first about why do you think that chronic Lyme disease is so often ignored?
Well, there's a lot of reasons. I feel like, we're not taught in conventional training about chronic Lyme. We're taught about acute Lyme, 2 weeks of antibiotics like doxycycline, and then things should be A-okay. So first of all, it's not in our training very much, if at all, or it wasn't in mine, I should say. Secondly, tests are really lacking. And so I feel like there's maybe an ELISA or a Western blot test, but really past that, there isn't any more searching for chronic Lyme. And if those tests are negative, it's just sort of an open and shut book for most practitioners. And that means a lot of people fly under the radar because the tests aren't perfect.
So if the testing's imperfect and people aren't taught about chronic Lyme disease, let's just start out by educating our audience on what is chronic Lyme, how does it manifest? Do you have to have had like a rip-roaring acute infection to have manifestations of chronic Lyme? What might our listeners be feeling if they are affected by chronic Lyme?
Well, first of all, I just want to say, because I don't think the listeners may know that Lyme disease is there's more incidence of Lyme disease than even breast cancer. And so because of, climate change and other things going on in environmental changes, Lyme, the ticks territory has broadened. And so there's really a lot more cases and incidents of that before I get started. Anyways, besides that, I would say that most people don't have, a lot of people, up to 80% don't have a bullseye rash. And so that's the heralding sign, if you will, of acute Lyme disease. And so many people will have maybe a day or two of achy joints and feeling like they're coming down with the flu or a cold. And then basically things kind of go underground after that. And then you're kind of waiting, and the things come out years later because Lyme is the great mimicker. And so people don't understand and aren't taught there's something chronic like that can live in their body and hide. And so it often flies under the radar, not only for doctors, but for the patients themselves.